Welcome to If I Die Today. It's a podcast hosted by me, Samay Mishra. Before we begin, I want to make something really clear. This podcast is entirely independent of my professional work and my company. The views and opinions shared here by myself or by any guest are personal reflections meant to inspire, inform, and provide perspective. Nothing discussed should be taken as professional, financial, or medical advice, nor as a representative of any institution or organization that we're affiliated with. This is a space for honest conversation about life, purpose, and what truly matters, all shared in a personal capacity. Really thank you for tuning in to If I Died Today. Thank you so much. Cool. So, hey everyone. It's been a minute, but season 2 has been kind of in the works in the background, and I've been trying to curate some really good guests for you. I actually posted something on my Instagram labeling out some of the guests that I'd like. And little did I know that Ayman, one of my close friends and like a brother to me, he is someone that fit a category of the oncologist. He is a doctor, Dr. Ayman Ullah. He has an amazing background and story, and he's one of the best people that I interact with in my life. I love talking to him just as a friend, and he has such a rich experience that I'm sure we're going to all learn a lot on the oncology side and even more on the global health side. He has both an MPH and an MD, both from UCLA. And yeah, I'll let you introduce yourself a little bit, but looking forward to having you on the pod today.
Yeah. Thank you for the kind introduction, Samay. Too kind, actually, but I really appreciate it. I remember, Samay, when I first met you, man. Me and Pratik were back home visiting from college, and I was like, "Who is this little guy busting our butts in hoop, man?" And now watching you and seeing your journey. So yeah, I'm really glad to be able to have this conversation and share a little bit of my experiences with you.
Awesome, man. So usually, if you've seen a few of the episodes, what I like to do is I like to get guests to give a little bit of background on their upbringing and childhood, but just get a gauge of, kind of how they grew up and what brought them to what they're doing now. So would love to just learn a little bit more. Tell me about what childhood was like for you growing up. What kind of characterized those memories for you? Was there any early role models or mentors that you kind of looked upon for guidance? And yeah, tell me a little bit more about that.
Yeah, absolutely. So I grew up in the Bay Area. My parents immigrated from Bangladesh in the late '80s, and they, kind of went through that immigrant grind and built a life for themselves. They kind of struggled through building a life for themselves, away from their family, away from their friends, and they built a community in the Bay Area amongst a lot of other Bangladeshis who also immigrated here for kind of those early engineering tech jobs that brought them over. And I remember, pretty early on, there was a huge emphasis in my life from my parents on, you can do what you want with your life, but make sure that you try and help people. And I know it's maybe a little bit corny, a little bit cheesy, but that was one of the overarching messages that I got. And when I recall kind of my upbringing and what it centered around, right? It centered around my family. It centered around our faith. And one of the things that I still reflect on, right, when I think about why did I become a physician and why did I become a doctor? It was my mom, teaching me about our faith and about Islam, and one of the verses from the Quran where it says, the person who has saved a life, it says, if he saved all of humanity, and she used that as a way to, I think, kind of nudge me towards thinking about a career in medicine. And it's something that I've reflected on a lot over recently about, if I could go back and do it again, would I do it again? And I think I would. And that's because of the influence that my parents had on me. I grew up surrounded mostly by engineers, not a lot of people in medicine. So it wasn't until, I met like-minded folks in college and that, I found a community of people who were also kind of striving on that same pathway. So I hope that answers your question a little bit.
Yeah. So it seems like, you had a general idea or at least a few nudges early on in childhood towards just helping people in that direction. But did you know that, going into college, that's like you wanted to be a doctor, study pre-med and go to med school, or were you still, like before you got to college, you didn't know what that looked like, and then in college decided that maybe med school was the path?
Yeah, I think I had an idea in college that med school might be the path that I wanted to head towards, but what I really loved was working with people and being able to just see improvement in their lives. And actually, one of the things that I got involved with in college was teaching first. And there was a program at UCLA called MAPS, which stands for Mentors in Academic and Peer Support. And essentially, we were just involved in a lot of one-on-one tutoring and mentorship with students at various high schools in East LA to try and get them SAT ready, to try and get them provide some private tutoring for kids who are struggling in their classes. And I actually really enjoyed that. And loved teaching enough where actually before switching to a career in medicine, I actually taught full time on the East Coast and kind of got out of my comfort zone. So I was prior to medicine, I was a high school teacher in Baltimore, which is where I met my now wife, and that was I really did think about staying in the classroom really really long and hard, but ultimately it felt like my heart kind of was still in medicine, and I made the pivot back towards school after teaching for a couple of years.
Okay, that's wonderful. So tell me about teaching. Like, what was something that surprised you? Obviously, East LA and Baltimore City, these are traditionally underfunded schools than we usually see in the Bay Area. Obviously, the Bay Area has pockets for that sort of scene. But what's something that surprised you, or what's something that you learned about being a teacher that still sticks with you kind of today?
Yeah, no, you bring up a great point. I think where I grew up in the Bay Area, there was a lot of privilege, and where I taught in Baltimore, that was not the case. I think what I still hold with me was the amount of inequity that I saw and how that inequity is often buried because of the demographic makeup of Baltimore and of my students. I taught in a school that was probably 95% Black. We had I had rosters of 50 kids and 30 desks in my class, right? So I would have students standing in the back, sitting on the windowsill, right? All of these things, which I think in a more affluent community, in a wider community, would have made front page news, but because
Mm,
it was an underfunded city, a predominantly Black city, a working class city, right? This is the expectation, right? This is the way things have been for generations. And so that's something that I still hold with me is the inequity that we see in the U.S. is it's very divided amongst class and racial lines, and so that's something that I still struggle with as to what's my role of how do I fight this system? How do I change this inequity?
yeah, no, absolutely. And for those of you either in the global audience or who are unfamiliar, a lot of how public schools get funding is district based, and districts are often redlined and sanctioned for a lot of reasons. Some are political incentives, some are for tax incentives. So based on the tax brackets is what money gets into the schools. So often those in lower income areas tend to have lower funding. So there's a lot of public schools in very affluent areas who have equidistant funding to private schools because a lot of wealthy people live there. But the opposite stands true for public schools, and they also tend to have the most volume too. So interesting. But obviously this was a good part of your journey because you met your wife, but tell me about that decision to go back into medicine.
Mhm.
What was that initial thought process like? And tell me about that journey back. You didn't apply for just med school, you were getting your MPH at the same time. I'm curious what that thought process was like when MPH traditionally wasn't as popular as it is now. I think post pandemic MPH and public health got a lot more surgency and interest and also funding. That wasn't as popular of a decision back then. So tell me what was going through your mind to do both at the same time and also, that push back to medicine.
Yeah, yeah. No, the pushback to medicine started in the classroom. So as my job in Baltimore was I was a special needs high school teacher. So on top of teaching, my classes, I also had a load of students who had to make sure that their IEPs, their individualized education plans were in place, that they had the accommodations that they needed in all their classes. Struck me was on my caseload of about 30 students. 18 or 19 of them had lead poisoning and led me down this kind of rabbit hole of, okay, why do so many kids here have lead poisoning? And if you look back at the infrastructure and the history of Baltimore City, a lot of Section 8 housing was painted with lead paint, as well as, and the water pipes themselves also had lead paint. So you have these kids, predominantly black, who are exposed to lead from a young childhood age. And one of the things about lead is that it actually has a sweet taste. So lead paint, you know, some kids will actually eat them almost like chips. And what struck me was this incredibly sad intersection of poverty, policy choices, and then the outcomes on individual health as well as population health. And I remember thinking to myself, there's so much good that I can do as a teacher, and teachers are doing incredible work in this school. How do I structurally, change what I'm seeing on a population level? And so that was the inspiration for going back to school and thinking about both an MD and an MPH, and thinking about, public health as a way of affecting not just population health, but also individual health as well. That was just when I reflect on, why did I do that dual degree program? It really was the experiences in the classroom and the exposures that I saw that kind of put me down that pathway.
Yeah. No, it's beautiful to see how much the MPH infrastructure has also changed post COVID. Obviously, as a byproduct of something that's a very terrible event. But my girlfriend Anna just recently graduated with her MPH in global health, and I was at that facility, and it was so good to see how much interest has shifted towards actual structural changes in public health ecosystems, and how many people who may have gone down the MD or doctor path and have now pivoted to more global infrastructure, and then, hopefully that the entire world has changed their take on that. Some sort of silver lining, if there was any, with COVID. But on that path in med school, was there any inkling of you pushing towards oncology specifically? Tell me about what on that journey maybe pushed you towards oncology, or if there's a specific experience that you had that made that one feel like the right.
Yeah, yeah. I thought going into medical school, I thought I was going to do pediatrics. I enjoyed working with my students. I enjoyed working with kids, and I loved my pediatrics rotations, and I love my friends who went into pediatrics. For whatever reason, you find that when you're rotating through the different specialties, there's just some that you click with a little bit better than others. And for me, that specialty ended up being internal medicine. And specifically, within internal medicine, there's a number of subspecialties as well as general internal medicine. So things like cardiology, oncology, pulmonology, these all fall under the umbrella of internal medicine. But I remember rotating through my internal medicine rotation at Olive View, UCLA, which is one of the big county hospitals at UCLA. And I remember as a medical student being assigned a patient, young mom, probably in her early 40s, late stage breast cancer that had spread to her liver. And she was dying, and she was actively in the dying process. And I remember being at the bedside with her oncologist, with this woman, with her children, and the mom telling the oncologist, thank you for everything. You've given me several good years with my children, and I just want to thank you for all the care and love that you've shown. And I remember the oncologist crying next to me. And I think for a lot of people, that might have been a push away from oncology. And I think that's okay. Sometimes we want some distance between us and our patients and their suffering. But for me, it really highlighted the human element within medicine. And I just thought, wow, as sad as this moment is, there's still a beauty in this relationship that an oncologist got to witness, not just the relationship between the oncologist and the patient, but also getting to see the patient with their family and their loved ones, remembering their life together. And I thought, I could see myself potentially doing this and being a part of this subspecialty, but I still knew I needed more time to explore. That was actually the first experience where I remember thinking, okay, I could maybe see myself doing oncology. And it's still, all these years later, it's still an experience and a patient that I remember.
Wow. And I guess that's tough. Like, tell me about, you know, when you're in these environments, what do they tell you when you're at the hospital? Because I'm sure that there has to be some level of compartmentalization that you have with your patient relationships, but obviously, like, you're a human being and you have these emotions and empathy, but there's so much going on that you have to also keep a clear brain when you're diagnosing and trying to manage your own biases. Like, what is that, what are you taught on how to deal with patients and those emotions, or and kind of what do you actually see in your day to day on managing those emotions and, dealing with those relationships? Like, because you inherently get close with these people, and, some pass and some you're actually able to really help. How do you deal with those on a day to day?
Yeah, no, that's a great question. I don't think we're actually taught how to manage these emotions well within our current medical education system. I think it's something that every person goes through in a different way. I'll say I lean heavily on my support system at home, my wife, my brother, my parents, my friends, right? To often, just kind of talk things through, right? It's very hard to compartmentalize personally for me. I find myself becoming emotionally invested, and you see patients for years and years and years, and then things maybe don't go the way that you want. And on some level, you can take that personally, right? You feel a responsibility towards the patient and their family, and it's hard. It's something that I struggle with on a daily basis. I'm actually currently rotating on one of our tougher services at the hospital, our inpatient malignant hematology service. So we're treating patients with leukemias, lymphomas, and we have a young gentleman who is also in the process of actively passing away from his leukemia. And the other day, his wife was talking to us about, I just want to be able to dance with him in the living room again. And, I just want to see our kids grow up. And I think it's important to allow yourself to feel those emotions, right? On a certain level, you want to continue feeling that those very real emotions, because I think personally it makes you a better doctor when you're able to connect with patients and understand their profound sadness and understand their joys and their happiness when that time comes. But I don't know if that answers your question, but it's something that I struggle with on a daily basis. It's not
Yeah.
something that's taught to us, and I think definitely the field of oncology lends itself towards a lot of difficult and emotional conversations.
Yeah, definitely. But I can imagine that the positivity when things go well is, equidistant, right? Like the same way it could really hurt when something doesn't work out. I'm sure the ecstatic joy of a family realizing that someone is no longer dealing with this or combating cancer and winning or progression in research is equidistant on the emotional, roller coaster. So hopefully those moments kind of balance each other out a bit.
Absolutely, absolutely. I don't want to paint this picture of oncology being doom and gloom. It's not. The field has progressed so much in the last few decades, and I think just from a human perspective, we remember the cases a lot
Yeah.
more than remember the happier cases. So many, the vast majority of patients, right, that we take care of are doing well on treatment, right, and it is a blessing when you're able to tell a patient, hey, you're in remission or you are cancer free, and those moments are also really incredible and really special to be a part of.
Yeah. So I mentioned the research a bit, and obviously your background on the public health side, something that is a trend in the research that may not be present on your day-to-day visits.
Yeah, yeah. No, that's a fantastic question, and I'll kind of tailor it towards oncology. So the way that we make progress in oncology is with clinical trials, and clinical trials is often how we can answer the question: is X therapy better than Y therapy? Do patients live longer with these therapies? Right, and oftentimes we will have an idea that, hey, based off of these smaller trials or based off of this lab data, like we've got a really good inkling that this treatment can prolong someone's life. And what's been studied a lot and been looked at a lot is who actually has access to clinical trials, right? Who gets to get enrolled in clinical trials and experience these new drugs that may potentially prolong their life. And by far, right, the vast majority of patients who are enrolled in clinical trials tend to be patients who are of a higher socioeconomic status and patients who are white, at least in the US. And so there's been an active movement to try to make sure that we are enrolling patients from various backgrounds, but it's definitely still a huge work in progress. And it's an area that is, there's a lot of issues to delve into there, right? And we can talk about how historically, right, the medical system has just straight up experimented on black and brown people. So when you talk to black patients and say, "Hey, there's this clinical trial for a new drug that's really promising," there can be a lot of mistrust, and that mistrust is not undeserved, if that makes sense.
Yeah.
So there's a lot of barriers to getting patients from these underrepresented backgrounds into clinical trials, but it's a huge work in progress and something that I'm really passionate about making sure that our clinical trials represent the diversity of this country.
Yeah, that's something I've also seen just on popular media and in some articles about in med school, a lot of the actual textbooks and information that you guys are processing is predominantly on, white either bodies or, there are discrepancies between bodies and backgrounds, but it tends to be skewed towards that direction. I mean, we see that across the space, like a lot of the talk in the AI world that I'm in right now is because of, I think, the reduction in funding and diversity and inclusion and ODI and all these other programs, there has been less talk. But as far as AI itself, there's a lot of biases towards white, Western, those types of populations because that's where a lot of the data is presented. So something an AI chat, for example, there's a study done with ChatGPT responses in the United States versus Germany versus all these other countries, and there was different biases across the board. So I'm sure that also is prevalent in the not just schooling, but the actual information itself. So I'm sure that that's a conversation that you guys have, and I'm sure that has also been progression that has been made. But I think that's similar to kind of what we're talking about. But another question that kind of brings up on my side is you're multilingual, so you speak Bengali, Spanish, English, and correct me if there's more, but you've worked in Baltimore, LA, Sacramento, where these are very diverse populations across the board. How much of medicine is about the language? Because I mean, we both have immigrant parents, and I'm sure when they first came to the US, their English was not the best. So it always begs the question for me is when they were seeking care and the ability to articulate, the ability to ask questions, the ability for doctors to be able to answer questions. It's not just words. Tell me about that impact of how important language is in that process and, what being multilingual has allowed you to do and learn about compared to someone who may just speak English.
Man, yeah. No, language is enormous in a patient's belief in their accessibility to healthcare, right? And how they, in whether they believe that, you know, there's so much trust that's built in when the patient speaks the same language as their provider. And that's something that I've seen, I saw in LA with my friends who are very fluent in who grew up speaking Spanish. When they'd have patients who spoke Spanish, there's just this shared cultural understanding. At the few times here in California where I've had, Bangla speaking patients, it builds this rapport that's really, really hard to replicate with the use of a translator. And I think, especially a lot of our Spanish speaking patients here in California, there's genuine fear in kind of reaching out and getting the care that they need, right? And so when you're
Mhm.
able to reach them, through their shared language, it builds this bridge that it's not the same when you use a translator. I've had
Yeah.
the conversations with my friends who are physicians in New York. I'm like, part of me wonders, like, if I were in New York and I was taking care of, a patient population where there was much more, Bangla speakers, right? That's something where I sometimes wonder, could my skill set be more useful there? I'm here in California, and so a big part of the Sacramento are Spanish. So it's been important to try and get as fluent as I can in the language. And interestingly enough, specifically in Sacramento, we have a lot of refugees from Afghanistan. So there's a
Oh,
big need
interesting.
Dari and Pashto speakers, and it makes a huge difference. When I've worked with my colleagues who speak the languages, right, just seeing the way that they are able to connect with patients, and more importantly, how patients are able to communicate their needs with them.
Mhm.
So language is a critical part of a patient of the access that patients have to our healthcare system.
Yeah, absolutely. So I want to dig a little bit deeper into you and, how you have approached health and your practice. Each person has a different way of going about it, but I think you have a unique background. You've talked about earlier on how spirituality has played such an important part into your life and kind of nudged you in the direction of helping people and practicing medicine. I was reading something about you entering Ramadan, hoping it would feel peaceful, but it's not always feeling that way. What keeps you grounded in your spirituality in a field where you may witness a lot of suffering? And, how does faith and this in this space interplay in general?
Wow, yeah, that's another fantastic question. It's one of those things where I think a lot of people, when they see suffering over and over again, you question how could, if you believe in God, how could God have allowed, this to happen? How does God allow this to happen to people, right? And I think the more that I've gone through my training and my practice, I've really kind of relied on my faith to keep me grounded, recognizing that everyone's struggle is going to be different. Each person is going to have their own trials, their own tribulations. I'm blessed with good health now, but 20, 30 years from now, that's not a guarantee, right? And so just recognizing that everyone's going through their own struggle in a different way. And, you bring up, as far as the point about Ramadan, sometimes not feeling, um, as spiritually grounding as I want it to be. I think a lot of that also deals with my own expectations of the month. You go into Ramadan thinking, okay, it's going to be X, Y, and Z. But then, things come up, life happens, right? You deal with difficulties at work, at home. And so, understanding that it's not always going to be cookie cutter, perfect Ramadan day, right? It's going to be, there's going to be struggles. And that's part of the beauty of the journey as well. And kind of learning to navigate that with my wife, with my family has been something that's been really beautiful. When I reflect on patients who are at the end of their life in the hospital, right? And we have, chaplain services, we have priests come in, monks come in, imams come in, right? For their last rites. It's, it's always very sobering and beautiful to see how united that can make family members, and recognizing that this is the end of their chapter here, but whatever their spiritual beliefs are, that there's another journey waiting for them. Yeah, it's almost, sometimes it feels a little bit taboo to talk about within the hospital, right? I feel like a lot of doctors are like,
Yeah.
on the medicine. This is our field. This is what we focus on. But I don't think you can talk about physical and mental health while ignoring spiritual health, especially when you're having
Yeah.
challenging conversations about cancer, end of life. And so it's a part of our everyday conversation. Actually, when I see patients in clinic and they're healthy, right? That's the time to ask them about them. It's the time to ask them about, what their spiritual practices and beliefs are. And um, I think it helps not just build a relationship with the patient, but also helps me understand the patient and their background, and where they're coming from and what's important to them, if and when things change down the line.
Yeah. A lot of the times you can answer the hows, with science, but the whys, I think, are a ever persistent spiritual question. And I think you're forced to deal with the why a lot more being a doctor or being someone who explores the universe and learns more about medicine and so on. So that's reassuring to know that that's part of your practice, and it also helps maybe in a field that's filled with people who have to deal with those questions themselves. Another thing I wanted to ask, so a friend of yours started Gaza Health, and that was something that you were a part of, connecting cancer patients in underserved places to care. What's something you wish people knew or saw the medical lens that maybe normal people may not know, whether that's abroad? I know that you had some rotations that were in Thailand and some other global destinations. What's something you wish people knew about health that was happening across the globe that you see that, maybe other people's in the United States or in our, Western world don't really have knowledge or perspective into?
Yeah, yeah, no, and I'll kind of I'll bring up the experience that I had in Thailand. My last rotation of medical school, I spent 3 weeks in Bangkok at one of their big academic centers, Sirirat Hospital, which is just like any other hospital here in the U.S. Lots of resources, all the specialties that you can imagine. One of the things that really stuck with me, and I think is maybe it's a growing practice here in the U.S., is the blend of kind of Western medicine and Eastern medicine, right? So the top floor of this hospital was a space dedicated for traditional Thai medicine, where folks could come in and essentially, do aromatherapy, massage therapy. There was a whole kind of like natural pharmaceutical section, so that they would like build inhalers with herbs that they would harvest from the hospital garden. And I just thought it was such a beautiful use of natural resources that were just outside their doorstep, and also honoring traditional Thai knowledge and medicine. I think in the West we're very quick to disregard, um, you know, again, Eastern medicine as something that's foreign and something that doesn't work. But it was really incredible to see the blending of these two, I guess you could say, different ways of practicing medicine within the same hospital. And tying it into oncology, so many of our chemotherapy drugs come from plants, come from animals in the ocean. And, there's so much that the natural world has to offer. And I think a lot of our colleagues across the world recognize that and honor that a lot better than we do here in the US.
Yeah. I think the US has a certain stigma towards homeopathic medicine in general, but I think for us, like when we would get sick, I don't know about you, but my mom would always have these home remedies ready to go. And I don't know if they actually work or if I've been trained to believe that this works and something mentally happens. I guess that begs another question of mine. Is there something that you've ever seen about the impact of someone's mental state when it comes to going through a treatment, how they are either supported by their support system or how their like perspective impacts the medicine itself? I'm sure that there's some research on it, but I'm unfamiliar. Is there anything like a difference that you see with someone who has hope that this cure will work versus someone who's maybe a little bit more distraught, a little bit more shell shocked at the idea of getting a diagnosis? Is there a difference on how a mental perspective or a mental fortitude towards I can get better or I will get better, those types of perspectives impact actual treatment, or it may be too hard to say?
I think the experience I have is anecdotal, but I do absolutely believe in the mind body connection. And I do think that, you know, folks who are struggling with their mental health because of a physical diagnosis, I do think that affects their physical diagnosis. And from a support perspective, one of the things that we do within hematology and oncology is we do bone marrow transplants. And one of the criteria for actually receiving a bone marrow transplant is you need to have a support system, right? We are taking you to the brink of death with a bone marrow transplant. And when you go home, you're going to be very prone to all kinds of illnesses and sickness. And so you need people there who can take care of you. So it's sad, but when we talk to folks who say, "Hey, yeah, I don't have anybody at home, I don't have anybody who can take care of me," that's actually an exclusionary criteria for a bone marrow transplant. So absolutely, the support system that people have, their own mental health and their kind of own and their own approach to their illness does have an effect on their disease process.
Oh, I see. Is there anything that you recommend, like lifestyle habit wise, that you would recommend to them immediately? Or is that something that you let the patient decide on themselves? Because I've heard instances where people will get a diagnosis and they will switch immediately to a whole food, plant based diet, or they'll stop eating certain types of foods, or they'll be recommended to do these types of exercises. Like, is there anything that you guys off the bat kind of recommend or that you would encourage people to start doing in their lives today?
Yeah, while there haven't been any true like randomized controls trials that look at like the effect of like a whole type diet or like a plant-based diet, my recommendation towards for patients, and a lot of it depends on the kind of cancer they have and what have you not, is to try and avoid eating these processed foods that have unfortunately flooded a lot of our markets. To try and eat fresh where we can. I know it's difficult financially, especially now, and it's not that it'll necessarily prevent cancer or stop the cancer from growing. But
Sure, yeah.
for me, I think it's just another risk factor towards for chronic illnesses, right? And it doesn't necessarily have to be cancer, but even things like high blood pressure, diabetes, right? We know that these highly processed foods are not good when it comes to that. And so while there isn't like, quote unquote, like a diet that's, like a cancer type, a diet for patients with cancer, I do try to encourage my patients to not eat processed food where they can, and to try and eat, fresh whole foods. Try to switch to a plant-based diet if they're able to. And if they're going to eat meat, to not eat processed meats, and really try to focus on kind of fresh ingredients.
Name of the podcast is If I Died Today. I wanted to be something that touched all sorts of people, no matter who you were. And I think mortality is something that we can all empathize with, either the experience of it around us or what we will go through eventually one day. And maybe some of the existential dread or other feelings that are associated around that. I like to take a positive spin on that. I think those things, the inevitability of that creates a lot of purpose and meaning in our life. you spent your career around mortality in a way that most people never really get to or have to. Has that changed how you think about your own life, the choices that you make, the things that you prioritize, activities that you do to keep you sane? What are some of the things that a career in that space has taught you about your own life, or maybe changed how you see some of the things and how you live, how you live?
For better or worse, even though I'm very early in my career, I've seen a lot of people pass away in the hospital and at their bedside, and seen what the dying process can look like. And I've talked to people as they're approaching the last days to hours of their life, and no one has ever said, "I wish I bought that car," or I wish I, had this bigger house." Everyone always, not everyone, but the vast majority of people, when they reflect on their lives and I've spoken to them as they're actively dying, they express, if they express regret, it's regret about not spending more time with their loved ones, about not going on a trip that they wanted to when they were younger. And it kind of revolves around either appreciating all these experiences that they had or wishing that they had these other experiences. And so it's definitely shaped how am living my life now, where, my wife and we talk about this a lot, where, one day if we're, blessed with kids, we want to be able to have lots of experiences with them, right? And that may mean, you know, no fancy car, maybe not the biggest house, but we want them to be able to, reflect on their life and say, our parents took us to see all these different places and all these different cultures, and these are things that have really stuck with me and things that I remember. And so in that way, a lot of my patients who I've seen pass away have really influenced me, and influenced the way that I live my life. And, as I think about the end of my life, what do I want to remember when I'm on my deathbed, right? Do I want to lie there and think about, man, I wish I had done this, I wish I had done that. When you have the firsthand view and seeing and hearing those regrets, it does put into perspective, you know, our time here is so short, and um, the experiences and the people who we spend it with are what we remember.
Yeah, absolutely. And I think, a lot of people struggle with defining, I think, their purpose. And I think as someone who is actively going through that of trying to find a why behind life and what I'm doing, I know that's an ongoing question, but I feel like doctors and other people who are practicing in this space, I don't know if that's as big of a question for you, at least when it comes down to your profession, because what you are doing is inherently purposeful. And I think that that's a really beautiful part of what you do. You really don't know the upper limit of the impact that that can have on not just the people that you guys are saving, but the future generations, that the things that research will do and how things are progressing, with technology. All the impact is all inherently purposeful. And I think that people who are in that space don't have to double click on some of that. So the last question I had for you is, God forbid, if you were to die today, how would you like yourself to be remembered by those around you, your family, your friends? How would you have been, how would you have liked to live your life to be remembered by?
Such a great question, and such a wonderful concept, to your whole podcast. But if I were to die today, I would want my wife, my parents, my brother, all my friends that I've been blessed with to remember me as someone who showed up for them when they needed it, whether that was in person or over a phone call. Um, that's how I'd want to be remembered. Just to put it simply, I think I've been so blessed to have so many incredible people in my life. You, your brother, my family, my wife, and they've all showed up for me at various points in my life when, I didn't get a chance to share about this a little bit earlier, but I had a best friend in medical school. He passed away unexpectedly during our last year of medical school. And it was a really, really hard time in my life. People showed up to support him, his mom, to support me through that really challenging time. And the least that I can do for the people that I love is to show up for them in the way that they showed up for me.
No, that's beautiful. And, you're doing that. As someone who's close to you in your life, I think it's so hard to describe how fun it is when we're all together, whether it's a bachelor party somewhere across the globe or a wedding somewhere. But truly, every time I speak to you, I always get this sense of something like a deeper sense of spirituality in our conversations. You always ask about the things that matter to me. You make the people around you always feel loved. And man, like you are one of my favorite people to talk to. So I'm so glad I was able to have you on the podcast. I think a lot of people will benefit from learning about what you do and what you've done. I'm sure that there will be a lot of follow-up questions for me and for you that I will get from this too. But truly, Iman, I love you. I love everything that you do. I love your life. And thank you for joining the podcast. It really means a lot.
It's been a blessing and truly incredible to watch you, grow up over the years. And I love you too, man. And if it's okay, I'll just share. I'll share. My friend's name is Kwame, and he wrote a very short reflection during our first year of medical school when we were rotating with our chaplains. And I'd just like to share what he wrote, if that's okay here. Okay. The fragility of life is apparent when you walk the halls of a hospital and experience what might be the end of a journey for some patients. We spend our lives trying to arrive at a destination, going to work, going to school, rushing to a soccer game, getting a job, getting married. We, myself included, tend to focus on the end destination and forget to appreciate the journey that it takes to arrive. When we share personal moments with those at the end of their life journey, it reminds us of remaining present and enjoying the process to any destination we wish to arrive. Thank you for letting me share his memory with you, and for the beautiful conversation.
That was beautiful. Honestly, that was such an amazing way to end. And rest in peace to him. And his spirit lives on in you. So,
Share that with her. Yeah. Appreciate you, man.
awesome. Thank you everyone for tuning in. I'll leave the link to Iman's social media and stuff if you want to follow his journey. And yeah, thank you all for tuning in. Thank you for listening to If I Died Today with your host, Samay Mishra. Every story reminds us that life's meaning isn't found in what we achieve, but in who we become. Join us next time as we explore another journey, another life, and another reason to keep going. New episodes drop soon. So subscribe wherever you get your podcasts. And if today's conversation moved you, leave us a review or share it with someone who'd appreciate the message.